Prolonged patency of fully covered self-expandable metal stents with an externally anchored plastic stent in distal malignant biliary obstruction. Introduction. Endoscopic biliary stenting is considered the standard treatment for distal malignant biliary obstruction because sufficient and prolonged biliary drainage is essential to continue effective palliative chemotherapy. Self-expandable metal stents, SEMS, are recommended due to their durability and reduced needs for reintervention. Fully covered SEMS have advantages over uncovered SEMS in terms of the problem of in-stent restenosis due to tumor ingrowth or epithelial hyperplasia. Fully covered SEMS can also be easily removed and replaced after stent clogging during chemotherapy. However, the recent drastic improvement in the efficacy of chemotherapy warrants further caution with regard to stent migration, which occurs more frequently with fully covered SEMS than with uncovered SEMS. Recently, the authors demonstrated the anti-migratory efficacy of an internally anchored double-pigtail plastic stent for distal malignant biliary obstruction in a randomized comparative study. However, the authors noted some cases where the double-pigtail plastic stent was removed, along with the migrated fully covered SEMS, thereby requiring immediate reintervention, which may have occurred because of the shared axis of the two stents in the stricture. To solve the problem caused by the double-pigtail plastic stent being coaxial to the fully covered SEMS, the authors have devised an alternative anti-migration technique. It was assumed that the placement of a 7 French double-pigtail plastic stent side by side with the fully covered SEMS would not only reduce the stent migration rate, but also prolong stent patency with an increased chance of the double-pigtail plastic stent remaining in the original position even after migration of the fully covered SEMS. In this study, the authors aimed to evaluate the effect on increasing stent patency of a novel technique of externally anchoring a double-pigtail plastic stent to a fully covered SEMS in a distal malignant biliary obstruction. Methods. A multicenter retrospective cohort study was performed in patients with distal malignant biliary obstruction to compare stent patency between fully covered SEMS and fully covered SEMS with an externally anchored plastic stent. For external anchoring, a 7 French double-pigtail plastic stent was placed first in the bile duct, then a fully covered SEMS was deployed side by side. Results. Among a total of 185 patients, 65 had a fully covered SEMS alone and 120 had a fully covered SEMS with an externally anchored plastic stent. The median stent patency was significantly longer in the fully covered SEMS with an externally anchored plastic stent group than in the fully covered SEMS only group. The rate of stent migration was significantly lower in the fully covered SEMS with an externally anchored plastic stent group than in the fully covered SEMS only group. 10.8% versus 27.7%. There were no significant differences in the rates of stent occlusion and adverse events between the two groups. Conclusions. A novel and simple technique of anchoring an external plastic stent may decrease the risk of fully covered self-expandable metal stent migration and prolong stent patency without significantly increasing the adverse events rate in distal malignant biliary obstruction.